This morning I'm going to show you a result and a patient testimony on the Hyprocure. There is some misconception that Hyprocure is only good for children, but it's also great in older people, even elderly patients. The patient we're going to show today is a patient of ours. We've seen her as a foot care patient for years. She has some issues related to some mild diabetes and things of this nature. But today we're going to show you how we were able to correct a posterior tibial rupture in her foot, which was giving her quite a bit of problems, and she couldn't even hardly walk, so we elected to try to do the Hyprocure. Now, she has some arthritis in her foot. She's not the best candidate for Hyprocure. So what we did prior to inserting the Hyprocure, we took a 18-gauge needle and made sure we could get through the sinus tarsus properly to seat the implant. So we did that ahead of time, so we knew that was going to, we had enough room to put the Hyprocure in. We ended up using a number 6 on her, and her foot's drastically improved. And I want to show you her foot and also show the patient to you too. We'll show you the foot first. So here's our patient's foot. You can see we made a small incision here 7 months ago and performed a Hyprocure implant in the sinus tarsus area. Once again, as I've showed in other videos, the implant needs to be inserted mostly at an angle more medial towards your medial malleolus. You don't want to go straight across the sinus tarsus. You need to kind of angle it like this. You can see this patient has some venous stasis issues, some other comorbidities. So a bigger surgery would not be the best. She would not be a good candidate for that. But for this little surgery, it took less than 10 minutes, and we're able to do this under mostly local anesthetic with a little light max sedation. Now, our foot before the surgery was very collapsed. You can see now we're getting about 3 to 4 degrees pronation in the forefoot. She's got a very stable foot now, and that's about where you want to kind of stop at, about 3 to 4 degrees pronation. And that's why we let you do the number 6 implant, which gave us the exact amount of pronation we needed in her foot. So now I want to let the patient talk to you. This is our Hyprocure patient here, and she had a confirmed posterior tibial tendon rupture in her foot and was having quite a bit of problems before we did the procedure on her. Before we did the surgery, how bad was your pain for you? What was going on?
Oh, you don't want it.
Was it pretty bad?
It was.
Okay. Were you unable to do even normal stuff during the day and things like that?
Right. Without crutches or something,
right.
A walker.
Okay.
You could not bear for the heel to touch the ground.
So what we did, I had told you before the surgery you had a tendon rupture in your foot, and we tried some some immobilization. That didn't really help you that much, so we went ahead and tried the Hyprocure, and we kind of talked about the possibility it may not work, but because you had some arthritis in your foot. I know you had some pain afterwards. How long did the pain, after the surgery?
Well, the bad pain is 2 weeks.
Okay.
Then you know when you're trying to walk them.
Right.
But it was so much better.
Right. Okay, so now we're 7 months out. Let me ask you this. How is your pain now?
There's none there.
So you complete resolve in your pain.
Sure do.
So this testimonial here shows that the Hyprocure can in fact be used not only in pediatrics, but it's very effective even in our patients that are older, especially with things like tibial posterior dysfunction, and in this case it was posterior tibial rupture. So I just wanted to show that to you. This is a good procedure used for a lot of different deformities.